Have you ever thought about what's really in those pills you take every day? Most of us don't. We trust that the medications prescribed by our doctors are safe. But what if some of the most common drugs could actually be damaging our brains? It turns out that several widely used medications may increase the risk of dementia. This isn't just speculation. There's a growing body of research linking certain drugs to cognitive decline. And we're not talking about obscure medicines here. These are drugs millions of people take every day for common conditions, like allergies, depression, and heartburn. The idea that everyday medications could cause dementia is pretty scary. It goes against our assumption that approved drugs must be safe, but the human body is complex, and even helpful medicines can have unintended consequences, especially with long-term use. In today's video, we're diving into a super intriguing topic: 7 common medications that can cause serious dementia. Can these daily medications actually lead to dementia? Or is that just a myth? What is the scientific basis for this? Would you like to know if any of the medications you regularly take could be on this list? Before we dive in, make sure to hit that like button, subscribe to the channel, and share this with your friends and family. What type of medication do you usually take on a daily basis? Which part of the world are you from? Leave your comment below. Right now, over 55 million people worldwide have dementia, and more than 60% of them live in low and middle-income countries. Each year, nearly 10 million new cases are diagnosed. Dementia can come from different diseases and brain injuries, with Alzheimer's being the main cause, responsible for 60–70% of cases. Dementia impacts various aspects of life, such as thinking, memory, and mood, making daily activities more challenging. Additionally, certain medications can raise the risk. So which drugs should we be worried about? Based on current research, there are 7 types of medications that seem to pose the biggest risk. Let's find out what they are. 1. Anticholinergics. Anticholinergics are probably the biggest offenders. These drugs work by blocking acetylcholine, a neurotransmitter that's crucial for memory and learning. They're used to treat a variety of conditions, including overactive bladder, Parkinson's disease, and allergies. Some common anticholinergics include diphenhydramine, Benadryl, oxybutynin, ditropan, paroxetine, Paxil, amitriptyline, Elavil. Studies have found that people who use anticholinergics regularly have a significantly higher risk of developing dementia. The same study showed that taking a strong anticholinergic daily for 3 years increased dementia risk by about 50%. That's a pretty dramatic effect from what many people consider to be harmless medications. 2. Proton pump inhibitors, PPIs. Proton pump inhibitors are another widely used drug class that's been linked to dementia. These are the heartburn medications like omeprazole, Prilosec, and esomeprazole, Nexium, that millions of people take daily. PPIs work by reducing stomach acid production. The connection between PPIs and dementia isn't as clear as with anticholinergics, but several large studies have found an association. One study of over 70,000 people found that regular PPI users had a 44% higher risk of dementia compared to those who didn't use PPIs. How could heartburn drugs affect the brain? We're not entirely sure, but it may be related to vitamin B12 deficiency. PPIs can interfere with B12 absorption, and B12 deficiency is known to cause cognitive problems. PPIs may also increase the production of beta amyloid, the protein that forms plaques in the brains of Alzheimer's patients. 3. Benzodiazepines. Benzodiazepines are anti-anxiety medications like alprazolam, Xanax, and diazepam, Valium. They're effective at reducing anxiety in the short term, but long-term use can be problematic. Several studies have found that people who use benzodiazepines regularly have a higher risk of developing dementia. One study found that people who had used benzodiazepines for 3 to 6 months had a 32% increased risk of Alzheimer's disease. Those who used them for more than 6 months had an 84% increased risk. That's a pretty stark difference. The exact mechanism isn't clear, but benzodiazepines are known to affect memory and cognitive function even in the short term. It's possible that long-term use causes more permanent changes in the brain. 4. Corticosteroids. Glucocorticoids, often called corticosteroids or simply steroids, are a versatile class of medications used to treat a wide range of diseases and conditions. Just a heads up, these are not the same as anabolic steroids, which are typically used to boost muscle mass. Corticosteroids like prednisone are used to treat inflammation in conditions like asthma, arthritis, and allergies. They're very effective, but they come with a long list of potential side effects, including cognitive problems. A team of scientists from Leiden University Medical Center in the Netherlands has discovered evidence that prescribed steroids can cause structural and volume changes in the white and gray matter of the brain. A study published in the International Journal of Medical Sciences discovered that using corticosteroids for over 90 days significantly increases the risk of dementia in men and women of all ages, with the 50-60 age group being particularly affected. The risk seems to be dose-dependent, meaning higher doses and longer use increase the risk. Short courses of steroids, like you might take for an asthma flare-up, probably aren't a big concern. It's the long-term, high-dose use that's most worrying. 5. Antidepressants. Antidepressants, particularly a class called tricyclic antidepressants, have also been linked to increased dementia risk. These drugs work by altering levels of neurotransmitters in the brain, which can have cognitive effects. A study discovered that certain antidepressants, particularly those known as potentially inappropriate medications, PPIs like imipramine, clomipramine, trimipramine, amitriptyline, doxepin, meprogyline, fluoxetine, and tranylcypromine, are linked to a higher risk of dementia. It's worth noting that depression itself is a risk factor for dementia, so it's possible that some of this association is due to the underlying condition rather than the medication. Still, it's something to be aware of if you're taking antidepressants long-term. 6. Antihistamines. Antihistamines, especially older ones like diphenhydramine, Benadryl, are another class of drugs that may increase dementia risk. These drugs have anticholinergic effects, which, as we've seen, can be bad for the brain. Studies reveal a link between dementia risk and how often and how much you use anticholinergic medications. Taking a Benadryl capsule for occasional allergy relief is likely harmless, but regular doses of anticholinergic drugs over time could increase your risk. Newer antihistamines like loratadine, Claritin, and cetirizine, Zyrtec, don't seem to have the same risks, so they're probably a safer choice for long-term use. 7. Opioids. Finally, opioids, which are commonly prescribed for pain, have also been linked to cognitive decline. A recent study delved into the connection between opioid use and the onset of dementia in people with chronic non-cancer pain in South Korea. The findings reveal a 15% higher risk of developing dementia for opioid users compared to a control group. Additionally, those using opioids showed a 15% greater risk of Alzheimer's disease and a 16% higher risk of unspecified dementia, although no significant differences were found for vascular dementia. Using opioids regularly for chronic pain might up your risk of dementia and harm your brain health more than other pain relievers, says a study in the American Journal of Geriatric Psychiatry. Opioids are linked to dementia, but the significant impact is mainly seen in individuals aged 75-80. Again, it's hard to separate the effects of the medication from the effects of chronic pain, which itself can affect cognitive function. But given the other risks associated with long-term opioid use, it's definitely something to be cautious about. So, what does all this mean? Should we stop taking these medications? Not necessarily. Many of these drugs are important treatments for serious conditions. The risks of untreated depression or chronic pain, for example, may outweigh the potential cognitive risks of medication. But this information should make us more cautious about how we use these drugs. Here are a few takeaways. Don't take medications you don't need. This seems obvious, but many people take over-the-counter drugs like antihistamines or PPIs regularly without really needing them. If you can manage your symptoms without medication, that's often the best choice. Use the lowest effective dose. If you do need medication, work with your doctor to find the lowest dose that effectively manages your symptoms. Consider alternatives. For some conditions, there may be non-drug treatments that are just as effective. Cognitive behavioral therapy, for example, can be very effective for anxiety and may be a good alternative to benzodiazepines. Be aware of anticholinergic burden. Many drugs have some level of anticholinergic activity, and these effects can add up. There are online tools that can help you calculate your total anticholinergic burden from all your medications. Don't stop medications abruptly. If you're concerned about a medication you're taking, talk to your doctor. Stopping some drugs suddenly can be dangerous. Consider periodic medication reviews. As we age, our bodies process drugs differently. A medication that was fine in your 40s might not be the best choice in your 60s or 70s. Regular reviews with your doctor can help ensure you're on the most appropriate treatments. Be especially cautious with long-term use. Most of the studies linking these drugs to dementia looked at long-term use, often over many years. Short-term use is less likely to be a problem. Remember, the point isn't to scare people away from necessary medications. Rather, it's to encourage a more thoughtful approach to drug use. We should be aware of the potential risks and benefits of our medications and make informed decisions with our doctors. This research also highlights the need for better, safer drugs. As we learn more about how these medications affect the brain long-term, pharmaceutical companies can work on developing alternatives with fewer cognitive side effects. In the meantime, we need to be our own advocates. Don't be afraid to ask your doctor questions about your medications. Why am I taking this drug? Are there alternatives? What are the long-term risks? A good doctor will welcome these questions and work with you to find the best treatment plan. Remember, too, that there are many things you can do to reduce your dementia risk that don't involve medication. Regular exercise, a healthy diet, social engagement, and mental stimulation have all been shown to help maintain cognitive function as we age. These lifestyle factors may be even more important than avoiding certain medications. The human brain is incredibly complex, and we're still learning how different substances affect it over time. As our understanding grows, our approach to medication will likely continue to evolve. What we consider safe today might be viewed differently in the future. This isn't a reason to panic, but it is a reason to stay informed and engaged with your health care. Knowledge is power, especially when it comes to your brain health. By being aware of the potential risks of common medications, we can make better decisions about our health and potentially reduce our risk of cognitive decline as we age. If this video helped you out, why not give it a quick like and share it around? It could really help someone else looking after their memory health. Do you or someone you know take any of these medications? Drop a comment and let's chat about it. If you want to stay in the loop with more health tips, just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, check out these 2 videos we selected specially for you. I think you'll love them. Have an awesome day and remember to take care of your brain. Thank you for watching. See you in the next video. Bye.